Welcome to this video on health awareness. We will discuss the importance of being proactive about our well-being. Health awareness is a proactive practice, moving us toward preventative living rather than reactive medicine. It is built on three pillars: physical literacy, mental resilience, and social connectivity. Health is commonly understood as a multi-dimensional state of overall well-being, not just the absence of disease. Modern understanding takes a holistic approach to health. Good health is a dynamic state of overall well-being, encompassing physical, mental, emotional, social, and spiritual dimensions. Observable indicators include restful sleep, consistent energy, and a strong immune system. Important determinants of health include social and economic factors like education and income, the physical environment, individual behaviors, and biology and genetics. Ill health is related to malnutrition, unsafe water, unhealthy living conditions, and habits like alcohol intake and smoking. Other contributing factors are hard labor, mental tension, and lack of access to health services or education. Malnutrition is a complex cause of ill health, often driven by illness that changes how the body uses nutrients, which then makes the illness worse. Causes include reduced nutrient intake and malabsorption. The effects of malnutrition include low energy, muscle wasting, low mood, and reduced mobility. It also leads to a higher risk of fractures, infections, and increased hospital admissions. Preventative measures for malnutrition include eating a balanced diet and having small, frequent, nutrient-dense meals. Staying hydrated and regularly monitoring your weight are also important. Unsafe water and lack of sanitation are linked to ill health through infectious diseases like diarrhea, cholera, and typhoid. They are also a major underlying cause of malnutrition and stunting in children. Unsafe water and lack of sanitation led to diseases like diarrhea, cholera, and typhoid. Stagnant water facilitates the spread of malaria, dengue, and filaria. Unhealthy living conditions pose significant risks to physical and mental well-being. These can include environmental hazards, unsanitary conditions, structural risks, and psychosocial factors. Preventing unhealthy living conditions involves home maintenance, like improving air quality, controlling moisture, and installing safety alarms. Good hygiene and sanitation are also crucial, including targeted cleaning and safe food practices. Further preventative measures include adopting a healthy lifestyle with balanced nutrition, physical activity, and restorative sleep. Environmental protection, such as ensuring water safety, is also key. Unhealthy habits like alcoholism and substance use are major causes of bad health. They also lead to significant social problems at the family and community level. An unhealthy lifestyle, characterized by poor diet and physical inactivity, drives non-communicable diseases. These diseases account for approximately 71% of global deaths. Preventative measures involve a nutritional strategy that prioritizes whole foods and limits salt and sugar. Consistent physical activity, including aerobic exercise and strength training, is also necessary. Other preventative measures include restorative sleep and stress management through mindfulness. Substance avoidance, such as tobacco cessation and moderate alcohol use, along with proactive health monitoring, are essential. Hard labor and difficult work conditions involve physical, environmental, or psychological stressors that compromise a worker's health. Hazards include repetitive strain, chemical exposure, noise pollution, and operational risks. Prevention in labor-intensive roles focuses on hazard elimination, proper gear, and worker recovery. Measures include using mechanical aids, ergonomic gear, consistent use of PPE, and following climate control protocols. Patriarchy is a social system where men hold primary power, leading to institutionalized gender inequality. This system is defined by male dominance, male identification, male-centeredness, and an obsession with control. Dismantling patriarchy requires cognitive and educational shifts, such as gender-neutral socialization and inclusive education. Institutional and legal reforms, like pay transparency, are also vital. Mental tension or chronic stress acts as a silent engine that damages nearly every system in the body. Long-term exposure to stress hormones can lead to cardiovascular issues, immune suppression, and mental health risks. Preventing chronic mental tension requires a proactive toolkit. Immediate circuit breakers, like the 4-7-8 breathing technique, and lifestyle safeguards, like physical movement and sleep discipline, are highly effective. Lack of access to health services is a global crisis, with over 4.5 billion people not fully covered. Key barriers include economic, geographic, and sociocultural factors, as well as workforce shortages. Lack of access to healthcare increases mortality and causes chronic disease progression. Systemic solutions include universal health coverage, telemedicine, mobile clinics, and workforce incentives for underserved areas. Personal strategies to improve access include utilizing telehealth, improving health literacy, and proactive planning. Community-led solutions involve advocating for infrastructure and engaging health workers. Systemic policy measures to prevent lack of access involve supporting universal health coverage. Other strategies include advocating for mobile outreach and offering workforce incentives to retain doctors in rural areas. A lack of health education is a major barrier to public well-being, leading to a higher disease burden and increased healthcare costs. It is recognized as a key social determinant of health. Barriers to effective education include institutional neglect and resource shortages. Proposed solutions focus on prioritizing health in schools, digitization, and capacity building for public health professionals. Maintaining good health at home involves foundational habits such as physical movement, balanced nutrition and hydration, quality sleep and mental hygiene, and daily preventative care. Thank you for watching this video on health awareness.